For parents who are given the choice, it is a tough one, in-person or online-only learning. KHOU 11 Investigates has the very latest information about kids and COVID-19. Jeremy Rogowski dives into the numbers, the science, and one expert's back-to-school plans for his own children.
Since school hallways emptied in the spring, we now know more about coronavirus in kids. First, the numbers and the counties that track them. Back in April, children and teens made up 6 to 8% of COVID cases, but since then, that has jumped to about 12% overall.
Every day brings us new information.
Still, the global research is relatively positive about kids, says infectious disease pediatrician Dr. Michael Chang.
And a consistent trend is that the kids seem to be less likely to spread infection to each other and also seem less likely to spread infection to adults. Seems to be what's driving this pandemic so far.
That raises the question,
why is it different in children?
One theory is the difference in the lungs. Researchers say an adult has more enzymes called ACE2s than the developing lungs of a child. Those enzymes, they believe, allow the virus to enter the body cells. Think of them as tiny doors in the lungs. Children naturally have fewer doors, fewer ways for COVID to come in.
Perhaps it is the immature immune system in the children, right? Is actually helping them.
All factors for parents to consider, including Michael Chang, the doctor and father of two.
So they're 9 and 7.
Everybody's going to want to know, well, what is the doctor going to do?
Yeah, so
right now, he says it's a balance. There are many benefits to in-person learning, but no school, no matter what it does, he says, can mitigate the risk of transmission 100%. Back to you.
All right, thanks, Jeremy. We have compiled a lot of information about the coronavirus on our website. If you are looking for testing sites, symptoms to watch out for, or reopening plans for school districts in our area, just text the word FACTS to 713-526-1111. We'll send the information to your phone.